So Jim here hurt his foot, I think it was a few months back, with a wakeboarding incident, and he's been having some foot pain ever since. Now, one of the things you always want to look at for people with a foot injury is their resting posture. Now with Jim, what you can see is that he has something called subtle Cavus Varus foot, and you can tell by the arch on each side, but then also something called the peekaboo sign, where the medial aspect of his calcaneus is just showing on the inside of the foot. It's on both sides. All right, and then if you have Jim turn around, you can actually see each calcaneus is in an inverted position as well. All right, Jim, go ahead and lay down on your back head at that end. There are two possible causes for subtle Cavus Varus foot, and one of them being that the calcaneus is stuck in inversion and is having a hard time getting into eversion, and the other is that the first ray is stuck in plantar flexion. So we're going to check for both of those. If you want to come in a little closer, Sam. Come here. So there are two ways that I'll look at subtalar mobility, and we have this in another video. One is by creating like a figure 8 pattern, going back and forth on the subtalar joint, and the other is doing just pure inversion eversion there, focusing on the subtalar joint. All right, and what you'll find in a person with this injury is possibly limited eversion. Okay, and then to check mobility in the of the first ray, I'm going to show it actually on his left foot, that way the camera can see. But you can bring the foot into flexion, the knee into flexion like that, stabilize the posterior aspect of the foot, and then you're going to use your hand to block the talus to start, and then this hand is right at the navicular, and you're just going to move up and down, and then you slide down, hand at the navicular, and then the other hand slides down to the medial cuneiform, and same thing, slide up and down. And then you can move down to the cuneiform and the first metatarsal. And you can start by looking at it that way, or you can block the cuneiform and go up and down like that, plantar flexing and dorsiflexing the ray. All right, so we'll say that we checked both of those. To treat the subtalar joint to improve eversion, there are a couple different techniques that we'll show you. One being the Calcaneal Whip, where you bring the leg into a figure 4 position like that, and put your thumbs just inferior to the medial aspect of the medial malleolus, and provide a little traction, and from there you're just going to kind of bounce up and down and get a feel for the end range, and then you're going to thrust downward like that in a whipping motion. You don't want to go up and then down. The force is just down. And then another one that we'll like to use, let's have you on your side. If you want to come around this way, Sam. So the side you're treating is down when he's on the side, and then actually around this way. You put the foot so it's just off the table like that. My fingers are around the medial malleolus, or the lateral malleolus, and I'm going to use my hand to provide a force down through into the ground to improve eversion. And you can mobilize here, or you can do a quick thrust. All right, so that's ways to improve the eversion. And then to improve that plantar flexed first ray, what you can do, you come around here, is bring the leg into a little bit of internal rotation. You're going to find that medial cuneiform, first come up the metatarsal, and look for that joint line. You're going to place your pisiform right over that, and you're going to use your other hand to squeeze the foot, abduct, and then rotate, my thumb moving laterally. And then the force is mainly down into the table and then towards a little bit of the ipsilateral hip. Build up the tension there, and just thrust down like that. All right.